Hi guys, I wanted to go over the products that are going to be helpful as you prepare and heal from your ablative laser. Now, all of you are probably already on your skin prep, and that's hydroquinone plus a retinoid. You need to be on these for anywhere from 2 to 6 weeks before your procedure, and then you can stop them about 2 days before because they can be a little bit drying. It's no problem if you use them up until the day before the procedure, but 2 days before we usually stop them. These are also the products that you're going to restart eventually once you're healed. So Obagi Clear or Blender is our most popular hydroquinone, and then we also have retinols and retin-A depending on which product you're using. Now remember that the laser is attracted to water, so if you come in very dry and dehydrated, there's less target for the laser. So we really like things like hydrating serums with hyaluronics, like this one here, that you can be using up until the day of your procedure to give that laser more water to find so that you get a better treatment. Now, the Omni Recovery Kit is our growth factor recovery kit that is going to speed your healing. I'm going to go over these different products in here so that you aren't feeling very overwhelmed and you know what we're going to be doing. This core recovery complex is a blend of growth factors that will definitely speed your healing. You're going to bring your Omni kit with you to the day of your laser, and I'm going to put at least half of this bottle on your skin immediately after the laser. Whatever is left over, I'll give it back to you with a little syringe so that you can draw up the product. And when you take your first shower, you want to apply this directly to your skin after your first shower. Now that will probably use up what's left in the bottle, but if there's anything left after that, after your second shower, please top off or use what's left in this bottle to put directly onto your clean skin after your shower. We also have the Protective Recovery Balm, which is this, let me open it, light blue, greasy kind of moisturizer that you're going to be putting on your freshly lasered skin. Now this isn't very heavy, and if you had a deep laser, you may also be wanting to use some Aquaphor. So Aquaphor works the same way as the Recovery Balm. You don't want your lasered skin to dry out until it's healed over. So you'll be using the Recovery Balm several times a day and or Aquaphor. There's also a rinseable Azulene cleanser. This does have wheat germ in it, so if you are celiac, you may want to avoid using this cleanser. But this is a great gentle cleanser that can be used to wash your freshly lasered skin that you can start the next day. You can also use Cetaphil if there's something about this that you don't particularly like. The Amino Plex spray is also very cool. This has a bunch of peptides and minerals in it and will help to speed your healing. The problem is that this may sting a little bit. We recommend that you start using this at about day 3. And again, this is on freshly washed skin. Do a little test spot in one place. If it doesn't sting too bad, close your eyes and you can go ahead and mist your face and then go on to putting the balm on top, or by the time you're healed up more, maybe the medical barrier cream. There is also a mask in this kit, and this mask again has the growth factors in it. When your skin is healed over and just kind of red and tight, this is a great way to get more of those growth factors in to get a little bit heavier of a treatment for improved healing. Remember that growth factors not only help you to heal, but they help you to build collagen. So we like using growth factors for that immediate post-operative time, and then even longer with different products that we have here in the hospital. Now this is a cool product. This is the Elta MD Dermal Wound Cleanser. Consider this like Windex for your face. So right after your laser, if you're getting like blood or crust or some of the goo on there that you want to wash off, you can just spray this and just gently dab when you're not going to be taking a shower, just to keep things moist and to keep things clean. We talk also about medical barrier cream. Now, if you stay on the greasy balm or Aquaphor for too long, your skin is probably going to break out more and even get very itchy. When you've gone from weepy wet skin to more dry, intact skin that looks more like a dry sunburn, that's where the medical barrier comes in. This is just a very heavy moisturizing lotion that has very few additives in it that can irritate your skin. So if we lasered your neck, you may be able to go to this in 24 hours. If we lasered your face, you may notice that your forehead and cheeks are healed over, but maybe around your mouth and your eyes still needs a few days of the balm. So you can go ahead and put medical barrier cream on the areas that are no longer weeping and still use the more heavy moisturizing Aquaphor or balm on like around your mouth or eyes that might require a few more days. Now this is great for maybe the first couple of weeks after your laser, but it's a little too heavy for people to use every day long term. So this may become your night moisturizer for a little while you transition back onto normal skincare like your blender or clear, and eventually a few weeks later your Retin-A. It's also a good time to start thinking of other products that have growth factors in them, such as the IS Clinical Youth Creme or the Neo Cutis products. So if you didn't get everything you're supposed to do from my talk, remember that there's always an instruction sheet in there. Touch and look at these products ahead of time so that they aren't foreign to you after your laser. And since I've been using the Omni Recovery Kit, I kid you not, I think the healing time has decreased by about 50%. So other good things to remember are that the Valtrex is to help prevent cold sores. You should stay on that until your skin is healed over. And strict avoidance of sun a couple of weeks before your laser and up to a couple of months after, depending on how deep it is. So hopefully that's helpful. I'm trying to think if there's any other little pointers. Oh, expect to break out with a little bit of acne. That's normal. You can use an over-the-counter acne wash that has either salicylic or benzoyl peroxide. Usually using that for a day or two cleans things up pretty quickly. So good luck with your laser. Hopefully you'll understand these products with this video so it's not so overwhelming when we give them to you at your pre-op appointment.